June 28th, 2023. 5:47 am Eastern Standard Time. Miami-Dade County, Florida. 43 unmarked federal vehicles idle in a parking structure 6 blocks from Biscayne Boulevard. Engines running. Radios silent. Inside each vehicle, agents from the Federal Bureau of Investigation, the Department of Health and Human Services Office of Inspector General, and the Drug Enforcement Administration review photographs, addresses, and names on sealed indictments. They have rehearsed this operation for 11 weeks. Every door, every window, every exit route mapped, measured, and assigned. At 5:52 a.m., a single encrypted transmission breaks the silence across every channel simultaneously. Execute. 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 Within 90 seconds, doors open across 36 locations in Miami-Dade County alone. Agents in tactical gear move through the pre-dawn darkness toward medical clinics, luxury condominiums, private residences, and office complexes. They carry federal arrest warrants, search warrants, and seizure orders bearing the weight of a 2-year investigation that is spread across every region of the United States. But Miami is only one city. At that same moment, synchronized to the second, identical operations launch in Detroit, Los Angeles, Houston, Brooklyn, Chicago, Dallas, Tampa, Baton Rouge, Newark, Philadelphia, and dozens of smaller cities and towns. 324 individuals are targeted for arrest before the sun finishes rising over the eastern seaboard. This is Operation Smokescreen. And what federal agents are about to dismantle will be confirmed as the largest healthcare fraud enforcement action in the history of the United States Department of Justice. $14.6 billion. Not millions. Billions. Stolen from Medicare, Medicaid, Tricare, and private insurance programs designed to keep the most vulnerable Americans alive. The architect of trust. To understand how $14, $6 billion vanishes from a system built to heal, you first have to understand who is stealing it. Consider Dr. Rodolfo Gonzalez, a name you have never heard, a face that appeared on local Miami television no fewer than 14 times between 2019 and 2022, offering free blood pressure screenings at community health fairs, donating equipment to underfunded clinics, and shaking hands with city council members at ribbon-cutting ceremonies. His practice, Sun Health Medical Associates, operated from a modern glass front building on Southwest 8th Street. Bilingual signage, wheelchair ramp, a waiting room with fresh magazines and a mounted television tuned to daytime talk shows. Behind that waiting room, federal investigators would eventually discover, was a billing operation generating $412 million in fraudulent Medicare claims over a span of 41 months. Dr. Gonzalez was not treating patients, he was processing them. Elderly individuals, many of them non-English speakers, were recruited from assisted living facilities and community centers by paid patient recruiters. Individuals compensated between $300 and $500 per person delivered to the clinic. Once inside, patients received cursory examinations lasting an average of 4 minutes. Their signatures were collected on consent forms written in English they could not read. Their Medicare numbers were entered into a proprietary billing software system that Dr. Gonzalez's office manager had customized to auto-generate claims for services never performed. Genetic testing panels billed at $8,000 to $12,000 per patient. Durable medical equipment, back braces, knee braces, TENS units, ordered in bulk from warehouses in New Jersey and shipped to addresses where no patient resided. Compounded prescription medications billed at rates 400% above market value, prescribed to patients who never ingested a single dose. Dr. Gonzalez owned 3 waterfront properties, a 47-foot sport fishing yacht, and held accounts in 2 foreign financial institutions at the time of his arrest. He is one of 324. The investigation unfolds. The roots of Operation Smokescreen reach back to early 2021 when analysts at the Centers for Medicare and Medicaid Services flagged a statistical anomaly in billing data from the Southern District of Florida. A cluster of clinics, 17 in total, operating within a 12-mile radius, had submitted claims for genetic cancer screening tests at a rate 900% higher than the national average. 900%. That number triggered an automatic referral to the HA's Office of Inspector General. Investigators began pulling records. What they found was not a glitch in the data. It was a network. The 17 clinics shared overlapping ownership structures concealed behind layers of limited liability corporations registered in Delaware, Nevada, and Wyoming. Shell companies within shell companies. Bank accounts opened and closed within 60-day cycles. Patient lists that duplicated across multiple facilities, with individuals appearing to receive identical genetic panels at 3 or 4 separate locations within the same billing quarter. Investigators requested patient interviews. Of the first 47 individuals contacted, 31 had no memory of visiting the clinic attributed to their billing records. 14 confirmed they had visited once but described receiving only a brief conversation and a blood draw. 2 had been deceased at the time the claims were submitted in their names. Deceased patients. Billed for genetic testing. Approved. Paid. The investigation expanded. FBI forensic accountants began tracing financial flows outward from the Florida cluster. Every thread they pulled revealed another node. A telemedicine company in Texas prescribing opioids to patients its doctors had never examined via video or telephone. A durable medical equipment supplier in Michigan shipping $74 million worth of orthopedic braces to addresses that turned out to be vacant lots, storage units, and in one case, an abandoned car wash in suburban Detroit. A pain management clinic network in Louisiana where physicians' assistants were signing prescriptions pre-authorized by doctors who had surrendered their medical licenses years earlier. Each node connected to another. Each connection revealed a deeper layer of coordination. By mid-2022, the investigation had identified fraudulent billing schemes operating in every single federal judicial district in the country. The combined alleged fraud totaled $14.6 billion, a figure so large that investigators initially assumed a calculation error. It was not an error. The enablers. Fraud at this magnitude does not operate without infrastructure. Behind every fraudulent physician, there exists a supply chain of corruption as intricate and deliberate as any legitimate business operation. Patient recruiters, known within the schemes as runners or cappers, operated on commission. Federal documents detail payments to over 900 individuals whose sole function was delivering human beings, primarily elderly, disabled, or homeless individuals, to clinics for the purpose of harvesting their insurance credentials. Runners operated in parking lots of dialysis centers, in the lobbies of subsidized housing complexes, at bus stops outside Veterans Affairs hospitals. They offered gift cards, cash, rides to the grocery store. In several documented cases, they offered opioid prescriptions as recruitment incentives. Beyond the runners, laboratory owners and diagnostic companies served as the monetization engine. Genetic testing laboratories, many of them newly incorporated entities with no prior operational history, received specimens and billed Medicare at rates that generated profit margins exceeding 80%. One laboratory in New Jersey, incorporated just 7 months before its first Medicare claim, billed $193 million in genetic cancer screening panels before a single audit was conducted. Pharmacy owners participated by dispensing compounded medications at inflated prices, or, in some cases, billing for medications never dispensed at all. Wholesale pharmaceutical distributors shipped controlled substances in quantities that could not be reconciled with any legitimate patient population. One Houston-based distributor shipped 4.2 million doses of hydrocodone to a network of clinics serving a combined patient roster of fewer than 3,000 individuals. $4.2 million doses. 3,000 patients. The mathematics of that disparity tells its own story. The coordinated strike. Operation Smokescreen's arrest phase was executed across a 72-hour window beginning June 28, 2023. Federal agents, supported by local law enforcement in over 40 jurisdictions, executed more than 500 search warrants and 324 arrest warrants simultaneously. The numbers are staggering in their specificity. 145 defendants charged with healthcare fraud, 82 defendants charged with illegal distribution of opioids and other controlled substances, 51 defendants charged with money laundering, 46 defendants charged with aggravated identity theft, using the personal information of patients, many of them elderly, many of them mentally impaired, without consent or knowledge. Among those arrested were 78 medical professionals. Doctors, nurses, pharmacists, individuals who had taken oaths to protect human life and instead converted human suffering into personal wealth. 27 of those medical professionals were charged with conduct directly resulting in patient harm, including unnecessary surgical procedures, dangerous drug interactions for medications prescribed without examination, and delayed treatment for legitimate conditions that went undiagnosed. Because the clinics processing these patients had no interest in their actual health, Attorney General Merrick Garland addressed the media from the Department of Justice headquarters in Washington. The defendants arrested today allegedly participated in one of the largest healthcare fraud schemes ever prosecuted. They exploited positions of trust. They exploited vulnerable patients. They stole billions from programs that Americans depend upon for their health and their lives. This department will continue to pursue healthcare fraud with every resource at our disposal. FBI Director Christopher Wray added a single-pointed statement: healthcare fraud is not a victimless crime. Every dollar stolen is a dollar taken from a patient who needs it, a program stretched thinner, a system pushed closer to failure. The human cost. Behind $14.6 billion in fraudulent claims, there are human beings whose lives were altered, diminished, and in some cases ended. Margaret Ellison, 79 years old, a retired schoolteacher from Baton Rouge, Louisiana, was recruited from her assisted living facility by a woman who offered her a free ride and a health screening. Her Medicare number was used to bill for $340,000 in genetic testing, durable medical equipment, and compounded medications over 18 months. She received none of it. What she did receive were 3 unnecessary prescriptions for blood thinners that interacted with her existing cardiac medication. She was hospitalized twice. Her daughter submitted a victim impact statement to the federal court. My mother spent 40 years teaching children to read. She trusted people. She believed a doctor's office was a safe place. These people used her trust to steal from her, and they nearly killed her doing it. Marcus Williams, a 63-year-old Army veteran in Detroit, was recruited outside a VA hospital and transported to a pain management clinic where he was prescribed oxycodone without examination. Within 6 months, he was dependent. Within a year, he was purchasing heroin. He entered rehabilitation at the urging of his family. His treatment was not covered by the insurance that had paid for the prescriptions that created his addiction. These are 2 stories among thousands. The aftermath. In the months following Operation Smokescreen, federal courts processed the largest coordinated healthcare fraud prosecution in American history. Sentencing outcomes reflected the severity. Dr. Rodolfo Gonzalez received 22 years in federal prison and was ordered to pay $312 million in restitution. The operators of the New Jersey Genetic Testing Laboratory received sentences ranging from 15 to 19 years. Multiple defendants entered cooperation agreements, providing testimony that expanded investigations into additional networks not yet publicly identified. Asset forfeiture actions seized over $1.8 billion in real property, vehicles, financial accounts, and luxury goods. Federal agents cataloged Lamborghinis, Rolls-Royces, beachfront estates, private aircraft, jewelry collections, and cryptocurrency wallets. The material evidence of stolen healthcare dollars converted into tangible excess while patients suffered. The Department of Justice announced that recovered funds would be redirected to the Medicare Trust Fund. But the structural vulnerability remains. Medicare processes approximately 4.7 billion claims annually. The sheer volume creates an environment where fraud can embed itself within legitimate billing streams and remain invisible for months or years before detection algorithms flag anomalies. For every scheme dismantled by Operation Smokescreen, investigators acknowledge that others continue to operate, adapting their methods in real time to evade the pattern recognition tools designed to catch them. The warning: $14.6 billion. 324 arrests. 78 medical professionals in handcuffs. thousands of victims whose trust was weaponized against them. These numbers represent the largest single enforcement action. They do not represent the full scope of the problem. The National Healthcare Anti-Fraud Association estimates that healthcare fraud costs the United States between $68 billion and $230 billion annually. That range, that enormous, uncertain range, tells you precisely how deeply this corruption has burrowed into the system that every American depends upon. Operation Smokescreen proved that coordinated federal action can identify, pursue, and prosecute healthcare fraud at scale. It proved that no network is too large, no scheme too complex, no amount too vast for law enforcement to dismantle. But it also proved something far more unsettling. It proved that the individuals we trust most with our health, the doctors, the pharmacists, the clinicians who greet us with calm authority and white coats, can become the very architects of our exploitation. That a clinic with a wheelchair ramp and fresh magazines and bilingual signage can be nothing more than a processing facility designed to extract wealth from human vulnerability. The doors of those clinics are closed now. The architects are in prison. The yachts are seized, the accounts frozen, the shell companies dissolved. But somewhere, right now, in a city you know, a clinic you might drive past tomorrow, the next scheme is already running, already billing, already processing the most vulnerable among us through a system designed to heal them, and instead designed by someone to consume them. Operation Smokescreen shattered a $14.6 billion fraud. The question that remains is the one no enforcement action can answer alone. How many more are still burning behind